So today we're looking at the adductor groin squeeze. This is used as a reassessment measure. Initially they used it for diagnosis, so if your legs were straight it tended to be more adductor, knees bent like this, it tended to be more pubic symphysis, and then with your feet in the air it was more pectineus. But it's very hard to isolate that now, as the structures are, as you can see from the blog, are very intermingled. So we use it now just as a reassessment tool to see if your treatment has been effective or not. So the setup is patient lying supine with their knees bent. We start with the biofeedback at 10 millimeters of mercury. Then I get the patient to squeeze until they first feel pain. So with the reassessment, you either want to measure it to P1 and or to their maximum. So whether their maximum is restricted by pain or weakness, we want to determine that. So, Sophie, if you can squeeze your knees together until you first feel pain, I want you to stop there. Okay. And how much pain out of 10 are you feeling there?
About 6.
And stopping there. So a 6 out of 10 pain at 40 millimeters of mercury, I wouldn't be pushing them any further. But if they got to 40 and they had 1 out of 10 pain, I would then ask them to push as hard as they could until they either were stopped by pain or weakness. Then you repeat the test with their legs straight, so sliding their legs down, and do exactly the same thing. So I want you to squeeze your knees together until you first feel pain. And pain out of 10 there?
3.
So a 3 out of 10 at 80. So can you go any harder than that, or is that as hard as you can go?
Bit harder.
Good. And is that pain, or you just can't go any further there?
Both.
Yep, so there's a 3 out of 10 pain at 80, and then is that still 3 out of 10?
Yeah.
Yep, so 3 out of 10 of 90, and that's their R2. Then you repeat the test in 90 degrees hip flexion. I do it in this and feet off the bed. I do it in this way so that you're starting with the least provocative test first and then progressing to one of the more provocative. And exactly the same, squeezing as hard as you can until you feel pain. And pain out of 10 there.
7.
And coming back down.